Motivational Mondays is the perfect way to set the tone for your week. Everyone can use motivation. Mondays are amazing, rich with opportunities, full of potential, and now motivational. Your week begins here. Good Monday morning. I am Genevieve Jones-Wright, founder and lead empower mentor of Motivation.In.Action, or MIA. And I am just so thrilled this morning as we continue our Mothers in Action themed conversations to be joined by none other than Spshelle Rutledge. How are you doing?
I'm doing good. It's such an honor to be here and be before you and to participate in Motivational Mondays.
Yes, and you are looking fabulous.
I appreciate it. I tried, you know.
You brought it.
Thank you.
So, gonna ask you a question. You can go as broad as you would like or as narrow and specific as you would like, but who is Spshelle?
I am basically a mental health, public health advocate, Marine Corps vet, mom. I always say that. I am a significant other. I am a daughter. I am a Black woman. And I love it.
So, and a motivational speaker.
And then I also sell merchandise. So also, you know, because I like to speak about entrepreneurship and building, even as a mom, I do that. And I'm also a nonprofit leader.
And just a leader, period.
Yes.
I
appreciate it.
So what do you do in your everyday work life?
I am pretty much the mental health and education specialist for the African American / Black community under Breaking Down Barriers, and that is under Jewish Family Service out here. And outside of that, I just became a program supervisor, overseeing an expansion of that, in which we're basically educating on mobile crisis response teams, who they are, their alternative to calling the police when a person's in a mental health crisis, and also educating on substance misuse. And then our whole mission is to reduce mental health stigma and discrimination. And apart from that, just being an advocate, I serve on a couple of boards. So the San Diego Organization of Healthcare Leaders. I'm now the Early Careers Chair, but used to be the secretary. And I just bring, I'm a part of helping mold healthcare executives, which, you know, people, especially women and women of color, are scarce in these environments in healthcare period and mental health period. And so volunteering my time there to put together a program like one I'm actually putting on this month also, bringing just different hospital executives together to talk to early careers entering the field on behavioral health and integration, and why it should be integrated into primary care.
But you know, this is why you're the perfect guest for Mothers in Action, because you are leading on so many fronts. Mm-hmm. And so I do want to kind of break down all of those things because you are a Marine Corps veteran, and you talked about helping other vets. So what does that look like?
Yes. Well, I could say where it started was when I first served and I had to exit out the military, because one thing I will say is part of why I'm so passionate about healthcare and mental health is because I experienced my own, mental health conditions and stuff that had occurred because of me serving in the military pretty much. And I wanted to reduce that stigma because I didn't serve in country, so I wouldn't say that, but I was overseas. I was contributing to the fight that we were in between 2009 2014 in various ways. And it's not often talked about how much people still battle with mental health conditions outside of just the physical. And so when I first had to medically retire out of the Marine Corps, I was at Wounded Warrior Battalion here in San Diego, and when I was there, I actually connected with so many different veterans from the Army, Navy. I'm a Marine vet, yes, but we were all together, and I remember being able to help other military vets, and there was one in particular. He had experienced PTSD and actually received the Purple Heart, but from the outside you would think he's fine. You know, from the outside you didn't see anything in what he was going through, but it was severe. And I was helping him turn his gear in and things such as that. But what happened was he had a family, and they couldn't understand what was going on. And so during that time, he ended up his wife ended up filing for divorce, and he didn't really have as much support, which kind of worsened the symptoms. But part of it I couldn't help but see was because of the fact that there was this lack of understanding, it seemed, of the fact that no, he's not going to be exactly the same after witnessing what he had to witness and saving lives, yes, but at the expense of his life, right? And so I decided to go to school to get my bachelor's in healthcare administration first before taking a class in behavioral health, and realizing I'd rather be able to impact like thousands at once, which different individuals can in various ways, physicians and nurse practitioners and nurses and so on. But I liked public health because you are kind of affecting masses and you're a part of prevention, preventing certain things from getting that bad, certain conditions from getting that to the point of suicide or suicidality, or to the point of other conditions like heart disease or cancer, those types of things. And so mainly was got involved in that regard, and ever since have been active in that. Yeah.
Yeah, well, thank you so much for all of that. Like, you're still doing service.
I'm still doing service.
Yes. So, you touched on a lot of stuff, and you talked about mental health, and your official title
Yes.
is public health and mental health advocate.
Yes.
And you are just an amazing guest to have this month, because not only are you a mother making a difference and doing what you can in all the areas that you do, but you have this mental health component. So you're speaking to that. May is, of course, Mental Health Awareness Month. And, it seems like because of COVID, we're starting to hear more about public health. But day to day, before COVID, we've always had public health concerns. So can you just speak to that as to what you do every day, and like just make it make sense for the everyday person?
Some of the things I do every day is like education. So like there's various aspects of public health. There's the licensed professionals, social workers, physicians are able to be public health advocates, and then even like policymakers are able to be public health advocates and help change legislation that makes our jobs easier, right? To give funding to even other like nonprofits. So in my position, I'm the preventive side, and some of the things I do is educate. So whether that's through doing presentations, in which I love to meet the community where they are, or partner with other organizations and nonprofits. One of the things I love about the position that I just got in is the fact that not only am I like overseeing and also a part of sharing information about mental health and reducing the stigma around mental health, and then also sharing resources, which is another piece of that. Like some people are hesitant to seek services, or hesitant to seek healthcare in general for various things because of the stigma. I don't want to be judged for feeling sick, because to some people that might not be something that's attractive, or they want to tell their the place of work about it. And in my position, I educate psychiatrists who are in students who are fellows, for example, who are entering the field, about concerns, but not just broadly when it comes to mental health, but specifically to communities of color, like the Black community, right? Preach about equity and the importance of that, and giving examples thoroughly. For example, when it comes to us wanting to pray various ways, and why it's important to incorporate that a lot of the times when you are talking about giving medications when it is necessary, or when you're talking about actually seeing a therapist, in different ways to do that, and telling people who are in the position to make those changes the importance of doing that based off of studies and so on, which is all that public health is, and is spreading the word.
So I have to make sure we talk about this.
Yeah.
Because I know there's somebody out there who's saying, well, why does the Black community need a special person to kind of be an ambassador for public health or mental health? Breaking down barriers in the Black community in those areas. Why is that important? Why is it necessary?
There's a study that was done, and it was labeled, "We're not crazy, we're just coping with the crazy system," but it was done as a result of the Mental Health Services Act funding, and what has come down was basically the California Reduction in Disparities Project. And so a lot of what I like to share in that is still evidence to this day. It was one of the main studies done. I think, I don't know of any comprehensive 300-page page study that was done in any part of America except for the state of California. And it was in that study in which it was included communities from San Diego, from San Francisco, from across the state, and also other professionals that looked like us. And one of the things that was articulated that the community wanted and needed in order to have trust to seek mental health and public health services was having people that at least understood our plight. So let's say they do identify as another race, at least understood our plight, and was able to listen, was willing to, have empathy and be patient, because there is mistrust. We have mistrust in these various systems, and for valid reasons. At the end of the day, this, I'm not gonna. That's a whole presentation for another day. But I encourage people and viewers to look at, the syphilis experience that took place. Read more into Henrietta Lacks and the fact that her family still hasn't even gotten, reimbursed for the ways in which they use her cells, and it's like so interesting how, just sidebar, how we advanced healthcare as we know it, or race advanced healthcare as we know it, even at the expense of our lives.
Yes.
Right? And that's one thing I love to share and push. And so a lot of the things we do is individual, and it's like, we come from our ancestors in a culture in which we like to do things as a collective, as a family, and sometimes they don't even have to be family. Their church family is a family, for example. And, when I do teach, I like to tell certain professionals that too, like, their sister may not be their biological blood sister, but pretty much close to it. And that stems from a long line of, back in when we were, enslaved, right? There was times where we were taken apart, like, mothers were taken from the kids and so on and so forth. So wherever you were living, you had to, they became your family, and I feel like it stems from that. I also love to use this opportunity to tell people to help professionals that are in this field understand our plight more, that, we also date back before just being enslaved. Like, we were, kings and queens for real, and mathematicians and so on and so forth, and it's in our DNA to be smart, educated, and so on. And it's just these systems of repression that have made it, difficult, but we've can arise out of that, and as long as we have support and we know that we can go seek support, and that's help does exist at the end of the day, for us, and we can tap into that and be as excellent as we're born to be.
Yeah, girl, you are preaching. I love it. Earlier you talked about a big part of your job being preaching equity, but we really do have to talk about all of these things, because systemically and systematically our families were broken apart during slavery. And when you're talking about why we need someone like you, there's a huge distrust, like you talked about, but then there's also huge disparities as far as Black people are concerned in the healthcare system, whether it's physical health or mental health. Name it, we've got the disparities. So again, I just want to thank you for your service to our communities and what you do. Now, here's the $1 billion question. As our listeners or viewers tune into this conversation, no doubt they've been inspired by your story. They're ready to go out and tackle the world.
Yes, please tackle the world. The world is literally yours. I know it's cliche, but seriously, you have to see it that way.
Yes. So what would you leave them with?
So aside from that, what I just said, I will also say, for as long as you're living and for as long as you're breathing and for as long as that you're waking up each and every day, there is purpose attached to your life. Even if some days are hard or, sad, I mean, that's going to come. That's part of the emotions, and that's part of us as humans. Don't let that stop you from pursuing your goals, your aspirations. Aside from that, also to students, and that is a range. I'm talking about from youth on. Something I wanted to recommend is networking side, or like getting out and learning, aside from just doing school, actually explore, volunteer in your community, volunteer in the fields of which you're interested in, especially if you happen to be watching this and you're interested in any aspect of healthcare. I know that helped me really solidify what I wanted to do more. There was a lot of volunteering that I did do, and I didn't like it so much, and there was a lot that I did, and so it landed me to where I am today. Also, you don't have to be limited to just one thing. Time management is a big thing. It's and taking breaks and not being afraid to take breaks or being ashamed to take breaks. is a major in being able to do multiple things, but like the sky truly is the limit. And then especially for my moms, right? There is a sacrifice. So, you know, this is a short conversation and I could speak more another time, but like what I will say is it's very important. Like your children, you know, be your motivation because they're watching. Like I remember actually taking my son with me to school and some days, and thankfully had, you know, professors that understood, and, you know, don't be afraid to, you know, do what you have to do to excel, because, you know, you're also kind of showing that to your kids. And then if you don't excel one day, or you do feel like you mess up, give yourself grace, because the fact that we're even mothers in the first place is you know, powerful. And to women, period, regardless whether you're mothers or you're not, you know, this the sky truly is the limit for us, and that's all I will say.
Well, child, let me tell you, you just heard it from Miss Rutledge herself. Your life is full of purpose. You have a purpose. Go
Mm-hmm.
out, get it. The world is yours. Take it over. You know, we've been talking a lot about passion, building what you love, and doing what you love here. So here's more encouragement this Monday morning coming straight from Spshelle. I
Yeah.
mean, if she is not a shining example that you can do so much in the roles that you have, I don't know who else is. So I'm just going to
Yeah,
say we're going to take your lead on that as we jumpstart our week. Thank you
for
so
sure.
very much for all of the gems that you have left us with today. That's it for this week. You have been motivated, you have been inspired. Go ahead, go ahead, go out there and tackle the world. I'll see you next week. Thank you so much for joining us for this week's Motivational Mondays. I'm going to see you next week, same time, same place, right here, with more inspiration to help you jumpstart your week. Now, if you found this week's conversation inspirational or motivational in any way, maybe you got a gem to carry with you throughout the day or the week, please feel free to like, comment, and share. Because remember, everyone can use some motivation. And if you haven't already, please subscribe. I'll see you next week.